This is PediaCast.
Welcome to PediaCast, a pediatric podcast for parents. And now, direct from the campus of Nationwide Children's, here is your host, Dr. Mike.
Hello, everyone, and welcome once again to PediaCast. It is a pediatric podcast for moms and dads. This is Dr. Mike coming to you from Nationwide Children's Hospital. We're in Columbus, Ohio. It's episode 537 for May 10th, 2023. We're calling this one Supporting Children and Teenagers with Developmental Differences. I want to welcome all of you to the program. So we have a topic for you today that is important really for every single person who is listening. And that is because all of us at one time or another, at one place or another, will surely engage with children, teenagers, and families who are impacted by developmental differences. However, and this is really important, these folks are not defined by their differences. Their differences make them unique, sure, but we can also discover lots of similarities in the people we meet. Shared hobbies and favorite books, music or movies, shared recreational experiences, favorite foods, and really getting to know someone, understanding their experiences, their interests, their challenges. That sort of engagement promotes relationships and empathy, which is a really important thing for families, neighborhoods, and communities. And it's not only important that we, as adults and parents, develop relationships and empathy with those impacted by developmental differences, it's also important we teach our children to do the same thing as they engage with classmates and friends and become the adults and parents of tomorrow. So what exactly do we mean by developmental differences? Well, first we have to talk about typical development, which defines the physical and emotional and cognitive actions and behaviors which children and teenagers can do and feel and understand at particular ages. For example, the classic developmental milestones. We say that kids should be able to sit up without support around 6 months of age, or crawl at 9 months, or stand and walk around 12 to 15 months. And we can keep that up with milestone ages for the development of language, talking and forming sentences, social milestones such as playing with others and following rules, and milestones for more advanced physical activities like running, skipping, jumping, and so forth. So we have clear age-associated milestones for typical development. And then once we've defined those milestones as a baseline, then we can consider folks who, for one reason or another, have difficulty or an inability to do or understand things that would otherwise be expected. Now, possibilities include external challenges, like the child with cerebral palsy who gets around in a wheelchair, or maybe internal challenges, like the child with autism or ADHD or a learning disorder. And it's important that we see and interact with all children and teens as people, and it's important we teach our kids to do the same. So lots more on this as we progress through the episode. To help us with the topic, and in our usual PediaCast fashion, we have two terrific studio guests who will be joining us. Dr. Karen Tabern is a clinical psychologist and clinical coordinator for the Autism Outpatient Psychotherapy program at Nationwide Children's Hospital. And Dr. Jacqueline Wynn, she's a clinical psychologist and director in the Center for Autism Spectrum Disorders at Nationwide Children's Hospital. Before we get to them, let's cover our usual reminders. Don't forget you can find PediaCast wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. If you like what you hear, please remember to subscribe to our show so you don't miss an episode. And please consider leaving a review wherever you get your podcasts so that others who come along looking for evidence-based child health and parenting information will know what to expect. We're also on social media, and we love connecting with you there. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. And if you have an idea for the show, maybe a topic you'd like us to cover in the future, head over to PediaCast.org. That's our landing site, and you'll find a handy contact page where you can communicate with the program. Also want to remind you the information presented in every episode of our podcast is for general educational purposes only. We do not diagnose medical conditions or formulate treatment plans for specific individuals. If you have a concern about your child's health, be sure to call your healthcare provider. Also, your use of this audio program is subject to the PediaCast Terms of Use Agreement, which you can find at PediaCast.org. So let's take a quick break. We'll get Dr. Karen Tabern and Dr. Jacqueline Wynn connected to the studio, and then we will be back to talk about supporting children and teens with developmental differences. That's coming up right after this. Dr. Karen Tabern is a clinical psychologist at Nationwide Children's Hospital and an assistant professor of pediatrics at The Ohio State University College of Medicine. She serves as the psychology supervisor and clinical coordinator for our Autism Outpatient Psychotherapy program. Dr. Jacqueline Wynn is also a clinical psychologist and an assistant professor of pediatrics at Ohio State. She serves as director for the Center for Autism Spectrum Disorders at Nationwide Children's. Both have a passion for supporting children, teens, and families impacted by developmental differences. That's what they're here to talk about today. But first, a warm PediaCast welcome to our guests, Dr. Karen Tabern and Dr. Jacquie Wynn. Thank you both so much for stopping by and chatting with us today.
Thank you so much. It's really great to be here.
Thank you, Dr. Mike. We're really happy to be here.
Yeah, and I'm happy you're able to take some time out from your busy schedules to join us today. Karen, I wanted to start with you, and I think as we think about development and developmental differences, I think the first thing we have to do is just kind of take a step back and talk about normal or typical. I should not use the word normal, right? Typical development. And we sort of describe that in terms, especially in the younger years, as developmental milestones. I think parents probably have heard that term, when they go to see the pediatrician or if they've read parenting books. What exactly are developmental milestones, and in particular, typical developmental milestones?
Sure. Yeah. So developmental milestones are really meant to capture sort of sets of skills that most, or about 75% of children either achieve or can do by a certain age or age range. So they refer to certain things like sitting up or walking, saying first words, smiling or interacting with others. And they're really measured across several different areas. So when we're talking about developmental milestones, we're looking at areas like motor development and movement, and how are children developing speech and learning language, learning in general, but then also taking a look at behavior. So such things as like play skills and social development. And really it's, our pediatricians and family doctors really utilize these developmental milestones or these groupings of skills and age ranges to help kind of track how children are growing and developing. So, even though it's important to remember that children really will develop at their own rate, milestones are meant to help sort of provide a guide of when, most children are accomplishing these certain things. And so when we're really, talking about typical development, you're right. We don't really, use the term normal development per se, just because, every child is developing at their own rate. But this idea of typical development really refers to the idea that skills are generally being learned and accomplished in a certain order or a certain pattern, sort of within that certain time frame or age range. And that really, an example of this let's say like in the first year is really the progression of walking, right? So a pediatrician might say, it's typical that your child rolls over in a certain way by a certain age. And then that progresses to like sitting up and sitting independently. And you see this progression of those skills then into, taking a child's first step within, their first year of life. But when a child will do that will sort of be determined child by child.
Yeah.
But when we say typically developing or typical development, it's really referring to that the progression of these skills are happening according to sort of these particular timeframes.
Yeah.
And they're really helpful at sort of measuring and assessing. But at the same time, it can also be a challenge in terms of using the term typically developing because it doesn't really include kiddos that are experiencing developmental differences. So it's not really reflective of that or inclusive. And a lot of times it can be sort of a term that's used comparatively, to compare those with developmental differences to those that are not experiencing developmental differences. Yeah. So sometimes that term typical development or normal development, it can cause, stress or some negative feelings or upset for parents or caregivers or even individuals who do experience developmental differences.
Yeah, absolutely. And as you're speaking, and I'm thinking about typical development, it's kind of like a growth chart. And you have not every 12-month-old is going to weigh this amount. There's percentiles. And so you kind of want your kid to fit somewhere between the 10th percentile and the 90th percentile. So there's a range of what can be normal. But then if it's outside of those, then you do start to worry, for kids who are way up there on the growth chart or way under the growth chart. Then that can be an issue. And I guess, if you could have a chart for development, it'd sort of look similar, that some kids are going to walk at 12 months and others are going to walk at 15 months. And those can still, all be normal. Or again, here, the language, we have to get used to changing that around, because I like typical because when we do talk about folks with developmental differences, we don't want them to feel abnormal. I mean, they are who they are. And I think that's a really important thing. One other thing I want to point out is if you are wondering what these developmental milestones are, there's some great resources from the American Academy of Pediatrics and from the Centers for Disease Control and Prevention. And I'm going to put some links in the show notes so that folks can see what those typical developmental milestones look like. So as we move away from typical into developmental differences, Jacquie, what is it that we mean by that term, developmental differences?
Well, Mike, I think you explained it, and Karen too, really nicely, that, there's a typical range for certain skills to be presented and developed. But when you're seeing patterns of those milestones occurring a little bit late, occurring out of order, or even if it's a pattern, like certain clusters of things that are showing up as difficulties for the child, or things that are kind of moving in a different way, that can help a pediatrician know we might want to initiate a screening just to check and see how things are going. About 1 in 6 kids have a disability. The CDC has done assessments over time to look at this for kids, all the way from 3 to 17, and looking at maybe 10 different disability categories: intellectual disability, autism, cerebral palsy, blindness, deafness, ADHD. So looking at that, a full 17, almost 18% of children would fit into a category of having developmental differences. That's almost 1/5. And actually that number is growing, especially in autism and in ADHD and in intellectual disability. So we do need to, look out for these patterns in kids. And it could mean that there's a delay, like there's a different pace at which they're developing. So maybe all of those milestones that Karen was talking about are emerging in a slower way. But it also can look more disparate, like certain areas of development, are maybe falling behind. In cerebral palsy, it might be motor issues. In autism, it could be their social engagement, with others that are the first things that people are aware of. If it's a language disorder, it's going to be in the language area. But it also could be that there are just differences, in how that is progressing as well. Certain things come out of order. So, for example, some children with autism are quite precocious in reading or in their memory skills, but yet other parts of their development are in delay. So looking at those kind of patterns can be helpful. And some of our disabilities that we might identify or differences can be quite apparent, are very visible to an observer. And sometimes they're more invisible, so it's harder to detect these things. And so there's quite a range of when these developmental concerns might be identified as and diagnosed. So some kids with autism, for example, aren't diagnosed until 8 or 9 if there's certain skill sets, that are more apparent. Or a child with ADHD might be when they're in 3rd grade, because that's when, those restrictions happening in school, say, are making some of those developmental differences, impact, their functioning in school a little bit more. So there's quite a range.
Yeah. Karen, how can parents determine if their child is identified as having a developmental difference that's not necessarily adhering to the typical pattern that would be expected? How do you know when that's a cause for concern or just something that makes them different?
Sure. So I think that your point about some of the resources that are put out by the American Academy of Pediatrics and the Center for Disease Control really are a great place, for parents and families and caregivers to start, that they're tracking. And I just want to put a plug in too. They have some great trackers and apps and, all those tools as well. But I think in terms of, how do we determine if there is a concern, would be, if we are, sort of like what Jacquie was referring to as well. If you're seeing patterns that are different or you're seeing a lack of progression, if you're seeing long periods of time where there isn't growth or development that seems like it should be happening, there are some sort of like red flag indicators that are out there that you can look at, if children are not making eye contact or they're not cooing or they're not doing certain things early on, then those can sometimes be signals that there might be a concern, but not always. And so really it, if a parent or caregiver has a concern, they are really the ones that know their child and the pattern of their child's development the best. And so encouraging them to reach out to their pediatrician or to their state's early intervention organizations to really discuss what their concerns are and to determine, is this something that, where we are sort of still within range or we are okay to still monitor, or are we seeing some of these red flags and do we need to do a little bit more of a further, assessment or evaluation of what's happening? But I think, parents and caregivers really can get a feel for, how their child develops and how their child progresses. But if there seems to just really be sort of a lacking of that or, that sort of thing, it's always good to ask questions and empower families to really continue to seek out, some assistance in evaluating whether or not that would be, a concern of a developmental disability.
I feel like in the younger kids, there's kind of more of a gray area of are we worrying? Are we just waiting and watching? But then as you get a little bit older and you start thinking about outcomes and quality of life, when those start to become impacted, like a child's ability to have a set of friends or their ability to perform well in school, if their life starts to be impacted, and I guess the definitions of those impacts would be what's important for a particular family or culture, But if it's something that seems to be hindering their advancement into, being a part of a community, it's something that we want to definitely intervene in. Is that a fair assessment?
Yes. Yeah. I think that is a great addition, a great point, because that is really, what we look at and are oftentimes discussing with families is, how they feel about, their child's development and if they feel it's a concern. Or, we are looking at those places where we're seeing some impairment or that, something is causing the child some distress because of, a skill deficit or something like that. So you're, spot on with that in terms of looking at the functional impairments around it.
Yeah, Jacquie.
Yeah, and I like how you phrase that, Mike, because a lot of times what we're kind of coaching families on as they're trying to understand their child's development is to figure out maybe what that individual child needs. And, we've kind of got it worked out in a lot of ways for kids who are typically developing. We know what kind of enrichments they might need. We know what's too much for them at different ages. And it's a new pathway when a child has a developmental difference. And so figuring out what we can do to support and provide extra resources and to help them achieve as much as possible, especially in that early developmental phase when, a lot of impact can really be, can be derived from interventions, but also to love and accept the child as they come, just as we would any child. And so to create that balance of providing that support, but accepting, how that child moves through the world and how that child's developing is a balance to at least try to achieve.
Yeah, absolutely. We've mentioned some of the disorders that would constitute developmental differences, but there's really a lot of them, right? There's developmental difference is not necessarily a diagnosis. Usually there's something underlying that is resulting in a developmental difference. Remind us, what are some of these things that we're talking about?
Yeah, so I think they can really come across a few areas. So they can be presenting in kind of a global way. So there could be just a global developmental delay where really all of the systems supporting the child are developing in a slightly slower pace. It could be more particular where it's a language, say a certain focus of development, like a language disorder. It could be an intellectual delay. It could be more motor related, like cerebral palsy. And some of them are clustered really because of their genetic causation. So Down syndrome, Williams syndrome, 22q, these are all genetic conditions that end up with the child probably having some kind of developmental difference as part of their profile. And then autism, again, is slightly different where many areas of functioning can be perfectly intact, but you see this pattern of social difficulties and then also these behavioral patterns of a kind of rigidity or inflexibility or repetitiveness in behavior. And when kids are young, it can look very clearly apparent that as they're playing, you can see how those behaviors are very repetitive, but it can be also very subtle as well. So it really developmental differences is a big category of all different kinds of presentations.
And that makes it a little bit of a challenge, doesn't it? Especially when someone is first presenting with a developmental difference, trying to figure out exactly what's going on. And I would imagine that there's often some frustration on the part of both parents and the provider because, as physicians and nurse practitioners, physician assistants, we want to be able to say, this is what is going on. And sometimes it just takes some time to figure that out, right?
Yeah, I think that's definitely right. So, a pediatrician has 10 minutes, maybe 15 at the most, to have a good conversation with a family during a well visit, and for a family to be aware of what they might need to be reporting in terms of their child development. That's, that can be a challenge. We do have nice tools out there. And so there are some expectations from American Academy of Pediatrics about, say, autism screening, that there's a hope that at 18 and 24 months, there's some questions about, how's your child's eye contact going? Are they responding to their name? What does their play look like? And then just obviously one of the primary things that's happening at well visits when kids are going at such a frequent pace in their early life is to check, that development. But sometimes it's hard to detect in those meetings. And sometimes it is across time. So like Karen said, I think at one point, if there's a bit of a delay at one point in time, by 3 months later, that could look quite different. And so it is a bit of a judgment call for a pediatrician and a family to figure out, like, when do we seek assessment? Being on the treatment side, of this world, we often think, assessment earlier the better. Just find out, then you'll know what's going on. And if there's not a concern, then you can move forward. If there's, slight concern and it demands monitoring, then that can happen. Or if it's clear, then the child can move into some supports or services. The family can get more education. And so, we tend to say err on the side of caution and seek assessment. And then you can figure out your path from there.
So I think from a parent standpoint, one thing that folks want to know is why. Why is my child experiencing a developmental difference? And when we have such a wide spectrum of things that can result in a developmental difference, really there's a whole host of reasons, right? What are some of those?
Sure. Well, I will start by saying, there are definitely, causes and reasons that we know of and have been well looked into, but there's also still a lot that we are still learning and a lot that we don't know. But what we do know is that, some developmental differences can begin, before a baby is even born, and some can happen after birth, and that there really is this, combination of factors, that can contribute. So some of those are biological or genetic factors. So, factors that are specific to a child or hereditary, through genetics, through the parents or caregivers. And sometimes that's a portion of that. And how much is still, we're sort of figuring out in certain situations for certain differences. And then there's other things, like prematurity, they're untreated, serious medical conditions or illnesses or infections. We know that there are prenatal factors like drug and alcohol exposure or a lack of, prenatal care or maternal infection or things like that happen, during a pregnancy. But we also know, in terms of some environmental factors, there are things, thankfully not as, prevalent as it once was, but things like lead exposure or, toxins or things like that. But then there's also, I think a super important factor to really be recognizing is the experience of trauma and, potentially abuse and neglect and exposure to violence and, things like that can also impact a child's development and progression across time.
Yeah. One thing I want to point out, I think it's really important to say this, that there's no evidence whatsoever that vaccines would be associated, causative in terms of developmental differences. When you have a kid who's getting vaccines every couple months, at some point when developmental differences kind of show themselves, there is some likelihood that they may have had a vaccine in the last month or two, because all kids are at that age. But that does, just because something is associated in time does not mean that one thing causes the other. And there's been no evidence that vaccines cause developmental differences, correct?
Yes.
Yeah, and in fact, Mike, there are dozens of really robust, well-designed, lots of participant studies that show there's not a connection. So it's even more clear on the science front, from that perspective.
Yeah. And I would encourage parents, when you are looking things up on the internet, really consider the source and the expertise of the source. And and trust your local, your family's doctor. I mean, you are putting your child's health, into someone's hands in terms of guidance. And so you want that to be someone that you trust, and to ask them about vaccines and where they get their information. Speaking of resources, Jacquie, what are some resources that are available for families who are impacted by developmental differences? Where can they find some help?
Well, I think starting with your pediatrician is always a great place, because pediatricians are experts in child development. And they often are connected to the resources that might be relevant for that family's, particular need. But often pediatricians are referring to specialists. So there are developmental and behavioral pediatricians out there who might be a next stop for a family who has a child with a developmental difference. And that physician can help determine, what the condition is, if there is a condition, and, whether there are genetic components to it, whether there are other medical concerns that might come along with it. And so, with, say, Down syndrome, we're going to want to watch the other medical, comorbidities or other, concerns that might arise, in addition to the developmental, components. So a pediatrician and a developmental and behavioral pediatrician can really help with that. I think there often is support that can be had through psychology services as well. So lots of psychologists are developmentalists and have a focus on supporting developmental differences. But in terms of the systems that are out there, there are early intervention systems in every state. They're called different things in different states. Ours is connected with a program called Help Me Grow, but early intervention is kind of the main name of that service in Ohio, in particular, where we are. And those programs can supply speech and occupational therapy sometimes. They can help with diagnosis, and other therapies, as a family might be wanting to design for their child. As kids get older, when they turn 3, early intervention is for 0 to 3-year-olds. And then once a child turns 3, a school system is there to provide educational supports, and that's inclusive of all children. And families and children have many, many rights in the United States with regard to education, even if they have developmental differences. And so a family getting connected with their school system, knowing what options there are, building in a connection and a relationship with that system, because that's going to be a main support for a child with developmental differences for their whole childhood. Another system to understand are services for people with developmental disabilities. It could be called a board of developmental disability. It could be called a regional center. And there's many different names across the states. But these are programs where there are federal monies that are coming through states that are there to support people of all ages with disabilities. And so a service coordinator or somebody or a case manager, can help a family understand what are services that are available. Maybe there's a respite service where a family who's caring for a child with a developmental difference needs an afternoon to go do some other obligations. And so there could be respite, there could be transportation services, there could be in-home supports. There could be, as children get older and they're moving toward adulthood, maybe there's residential supports or supports for independent living. So there's all kinds of things to learn about. Families have to do lots of learning as their child is identified with having a developmental disability or difference, and that system is part of it. And then I think the last category I'd say is just looking out in the world at different agencies that care about, these kids and these individuals. Like you said, the CDC, Center for Disease Control, has lots of information about development. Autism Speaks is an agency that has a lot of autism information and runs something called an Autism Care Network that have many dozens of toolkits, they call them, for parents and caregivers to guide them through difficult, moments and, areas where they might need more education. And then I think one last thing is to think as kids get a little bit older, most states have supports for inclusive strategies to help people with differences make it in the world of work. And so looking for what that system is in your state, and in Ohio, it's called Opportunities for Ohioans with Disabilities. They can help a person get practice, experience, and support in the work environment. And even before that, schools, the Developmental Disabilities Network, and the folks working on work inclusion might have transition specialists that can help support that move from adolescence into adulthood. One other resource you could look at is a website called Ocali, OCALI, and it has tons of resources for families and caregivers for all kinds of different developmental differences. So I'd suggest looking at that as well.
Yeah,
so I think that's at least some of the supports a family can look for.
Yep. And a great place to start is with your child's medical provider, their medical home, and they are going to best know what's available in terms of resources in your individual community. But you did mention some of the online stuff that's available for everyone across the country. And Autism Speaks is certainly a very large organization with lots of support and educational material. And we'll put a link to their site in the show notes over at PediaCast.org. We also have an article from the American Academy of Pediatrics that I wanted to share with folks called Learning Disabilities and Differences, What Parents Need to Know. And it has lots of great information. And then, I'm a big fan of when you Google something, figuring out who is saying it, is it a reliable resource? And one of them that I found that as I was looking through their site just had a ton of great evidence-based information was from a place called Beaming Health. And it was a developmental differences resource page. And it had parent courses, websites, articles, books, social media accounts, really just a lot of stuff. And so I just wanted to put a plug out there because I was really impressed when I came across it. So I'll put a link to that in the show notes as well for you. And then, as we think about as parents and as adults, really engaging with both kids, young kids, older school-age kids, teenagers, and families impacted by developmental differences, our children are also engaging with all of those folks. And so it really becomes important for parents to talk to their kids about developmental differences. And Karen, what are some strategies that we can use as parents to really open up these conversations with our kids?
Sure. I think openness and willingness to answer questions and encourage questions from kids is really where a parent or a caregiver can start. I think, encouraging our kids notice, starting at a very early age, differences in others and differences in themselves. And so they have this natural sort of curiosity about what is happening. And if you've ever, I was just last week with my own young child, and who was sort of looking and gazing and trying to process and understand a developmental difference in another child. So I think just taking the opportunities to start that conversation, to talk about, what your child is noticing or what they're coming to you and trying to explain. And to really approach it in a way that suggests that developmental differences are okay and that everybody has areas of differences and similarities. And as you're talking about those differences that they might be observing or experiencing potentially for the first time, either in themselves or in others, it's important to sort of pair that with the similarities that they might have to others or that others might have to them as well, despite developmental differences. And what that really does is it promotes more inclusive thinking in a process of you're not just different from me. We may have some things that are different, but you're also similar. And we might also have similar interests or similar strengths. And really that lays the groundwork for families to be able to talk to their children, about really approaching developmental differences in a very kind and helpful and compassionate way that promotes friendship, and encouragement of others, rather than, feeling exclusive or feeling like, well, they're not like me, and, sort of promoting, that type of thinking. So really, the strategies are, just to, when you notice kids noticing, check in with them, bring it up, ask them what they're thinking about, what is it that they're noticing. But also if they come to you with questions, just answering honestly. And if they come to you with questions that you're not sure of the answers of yourself, it's okay to really say, I don't know. And in fact, that creates a learning opportunity for you and your child, to maybe learn something new or sort of look into something together.
Yeah, absolutely. A fantastic resource that comes out of Nationwide Children's Hospital is the On Our Sleeves movement. We've talked about this many times on the podcast, and it's really a fantastic online resource. And then there's also materials that can be used offline as well for folks as we think about mental health and behavioral health and that impacts children and families. And they do have a wonderful resource there called How to Teach Your Child About Developmental Differences. And it, as you mentioned, it talks about really promoting thoughts about similarities. Sure, there's differences, but how are we similar? Talking about the different types of differences. Some, are physical that you can see. Others may really only impact the brain or behavior. And then, as you mentioned, to encourage questions and even to support interactions. If a child sees someone, with a disability and they're asking questions, if there is the opportunity to engage with that person and allow the child to ask questions of the person. Of course, you want to get permission to do that first. But that can also be helpful. And this article talks all about these things. And so we'll put a link to it in the show notes over at PediaCast.org. There's also a YouTube video called Educating Kids About Developmental Differences, and I'll put a link to that as well. Karen, then as kids who are impacted by developmental differences, we mentioned briefly transitions, but at some point, that resource network that is pediatric in nature, as teenagers progress into young adulthood, often now you do need to transition more into an adult system. What does that look like, and how can parents sort of prepare themselves and their kids for that transition?
Sure. It continues to look different for every individual that is transitioning into young adulthood based on their own, individual development. But I think it's important to start early, when they are still teenagers, when they're still adolescents, to be, sort of thinking about what things still need to happen, what skills need to be focused on, what goals does the individual have. As an adolescent, they're also sort of forming their identity, and their developmental disability or their developmental difference might be a component of that. So how they perceive themselves and what they want to set as their goals. But what we know, starting early allows us to really investigate what linkages need to happen and what transitions need to be made. I think many kids are, or adolescents as they transition into young adulthood, are multi-system involved. So they may have, a family doctor. They may have a psychiatrist or a therapist addressing, mental health needs or other types of things. They may need, support for continued education or vocational training, or to transition, to living independently. And so some of those resources, like Jacquie talked about, where they might have home supports or people who can help guide them or get them into programs, to help achieve their goals, are really important. And often that takes a lot of time. So what we do know, particularly in Ohio, and likely beyond, is that in adolescence, there are experiences and resources that families can really connect with and take advantage of to help prepare for that transition. But it can definitely be a difficult and challenging adjustment. But hopefully that continuity of care that they, of the care they were receiving as adolescents, can help kind of carry them through until they really link into the adult system. But it is a change or a transition to navigate that for a lot of families feels very different. And can sometimes feel like there isn't a whole lot out there that's just sort of like, here, we have this, that families sometimes feel like they have to kind of look around and figure out what's best for them and really make that change. But it is important that, the child's pediatric providers are supportive of that transition and really help the family navigate that.
Yeah, I think that's a really good point. We do have quite a number of pediatric providers who listen to this podcast, and it seems like it would be a really important thing to help guide families through that transition, not just to say, okay, see ya, you're 18 or 21 and it's time to move on, but really to have some resources available in your community that you know about that you can guide families to and start talking about those things earlier rather than later. Not because, I want to get you out of my practice, but because we want to help you to have a great experience moving forward when you do graduate at whatever age that is, depending on a particular practice in a particular place. Here at Nationwide Children's Hospital, we have a fabulous support network for kids, especially with autism. And as we mentioned, Jacquie is a director of the Center for Autism Spectrum Disorders at Nationwide Children's Hospital. Jacquie, tell us a little bit more about the center and what you guys do and the sort of resources and support that you provide for kids and families.
Well, yes, we are a center for children, adolescents, young adults with autism, but we also are serving kids with other kinds of developmental concerns. And maybe I should say as an aside, we fit within a system that is working with all kids with developmental differences. We're one of the largest behavioral health providers, and within that, our focus on disabilities is about the largest, in the nation in terms of number of faculty, et cetera, across the spectrum of developmental differences. And so, once a child is diagnosed at our Child Development Center with a combination of psychologists and developmental pediatricians and speech pathologists, then they can move into a whole array of services depending on their developmental difference. So our center is set up kind of nestled into that whole big network for specific services for children with autism. And what we do is divide our care into 4 areas. And within those areas, there's lots of different services. So we have a set of services for kids who are younger, so under 12. And that includes some really intensive interventions when kids are young. So we can really jumpstart some of the developmental delays they may have. And we have some good research and evidence that, if we work intensively, from age maybe 2 to 7 or so, we really can make a lot of headway in some of the areas that are difficult for that child in terms of development and get them on a kind of different pathway, a little bit more established with some basic skills. But we also really focus on our families and caregivers. Kids with developmental differences in general live in a system, right? All kids do, but kids with developmental differences really depend on their environment and the people caring for them to be a part of their their development and their therapeutic trajectory as well. And so we spend a lot of energy helping our caregivers understand what autism is, how they can best support their child, how it's showing up in their child, because it can be very different. It's a spectrum disorder, so it can look really different, which is very confusing, as you're trying to parent. And so we do a lot of parent coaching, all different kinds of services there. And then as the kids get older, we have a transition program. So we have for kids 12 and over, services that are about giving them their a best set of skills for them to live their best lives, as they move forward, toward adulthood. And that can include, just some, continued skill building, but it also can include coaching about what those transition systems are into adulthood. It can be mental health supports because, as kids move through adolescence, that's when more of the mental health concerns develop. And we know kids with developmental differences, and in particular autism, have high rates of mental health concerns, in addition to their developmental difference. And so we need specialized providers a lot of times to understand, how can I address the mental health concern, like in the context of the developmental difference?
Yeah. And that's where you really need that multidisciplinary approach, right?
Absolutely. And we partnered a lot with our developmental behavioral pediatricians. We partner a lot with psychiatry. There are a lot of programs within behavioral health that we partner with. We partner with the gender identity program because that's a high prevalence of comorbidity and in autism. And so, and then Karen's program, which I could let her talk about, but Karen's program is specifically for those mental health concerns, especially for kids without intellectual impairment, which is a whole bunch of kids with autism that really need that evidence-based, mental health approaches. And then we have one other program where kids who present with just a lot of behavioral dysregulation, where it can even turn into safety circumstances, safety situations, safety risks. It can turn into injuries. So we do a specialized program where kids are safe, families are taught how to help their child de-escalate, help teach them coping skills so that any aggression or self-injury or destructive behavior, can be supported and moved through. And so that's called our complex behavior program. So that's Center for Autism, but we're definitely helped by all our speech and occupational therapists, the physicians that help, and all the other behavioral health providers that are caring for kids, say, with ADHD. When you look at 17% of children having a developmental difference, that needs a big network of care providers. And especially when that group is so different, we really need lots of different specialists. And I think the one other, clinical feature at Children's is also when you're looking at specific genetic conditions, we have specialized genetic clinics that are Child Development Center, psychologists and developmental pediatricians help run, and other specialists. So there's a full array of services at Children's.
Yeah. And we'll put a link to the Center for Autism Spectrum Disorders at Nationwide Children's Hospital in the show notes over at PediaCast.org. For this episode, 537, you'll find it there. And obviously, you guys take referrals from medical homes, from primary care physicians. And then there's also a way that parents can contact you and ask for more information. And that's all available at the website, correct?
That's right. We have some autism resource clinicians that are there to help parents get information, and providers and physicians out in the community to get information about care at Nationwide Children's or out in the community or around Ohio. So they are really a resource to help a family find the right path, for their next step, whether it's within Nationwide Children's or if it's something they need out in the community. But that's a unique set of supports that we want to provide to the community.
Yeah, absolutely. Lots of resources for folks, again, at the website, PediaCast.org. In the show notes, we mentioned stuff from the American Academy of Pediatrics, the Centers for Disease Control and Prevention, Autism Speaks on our sleeves, and we'll have all of those links for folks, again, over at PediaCast.org. So once again, Dr. Karen Tabern and Dr. Jacqueline Wynn, both clinical psychologists at Nationwide Children's Hospital, thank you both so much for chatting with us today.
Thank you so much for having us and discuss this important topic.
Yes, thank you, Mike. We're on a mission for inclusion of people with developmental differences, so this was so nice to be able to talk about. Thank you.
are back with just enough time to say thanks once again to all of you for taking time out of your day and making PediaCast a part of it. Really do appreciate that. Also, thanks to our guests this week, Dr. Karen Tabern and Dr. Jacqueline Wynn, both of them clinical psychologists here at Nationwide Children's Hospital. Don't forget, you can find us wherever podcasts are found. We're in the Apple and Google podcast apps, iHeartRadio, Spotify, SoundCloud, Amazon Music, and most other podcast apps for iOS and Android. Our landing site is PediaCast.org. You'll find our entire archive of past programs there, along with show notes for each of the episodes, our terms of use agreement, and that handy contact page if you would like to suggest a future topic for the program. Reviews are helpful wherever you get your podcasts. We always appreciate when you share your thoughts about the show, and we love connecting with you on social media. You'll find us on Facebook, Twitter, LinkedIn, and Instagram. Simply search for PediaCast. Don't forget about our other podcast. It's called PediaCast CME. That stands for Continuing Medical Education. It's similar to this program. We do turn up the science a couple notches and offer free Category 1 continuing medical education credit for those who listen. And that includes doctors, nurse practitioners, physician assistants, nurses, pharmacists, psychologists, social workers, and dentists. And since Nationwide Children's is jointly accredited by all of those professional organizations, it's likely we offer the exact credits you need to fulfill your state's continuing medical education requirements. Of course, you want to be sure the content of the episode matches your scope of practice. Shows and details are available at the landing site for that program, PediaCastCME.org. You can also listen wherever podcasts are found. Simply search for PediaCast CME. Thanks again for stopping by, and until next time, this is Dr. Mike saying stay safe, stay healthy, and stay involved with your kids. So long, everybody.
This program is a production of Nationwide Children's. Thanks for listening. We'll see you next time on PediaCast.